بسم الله الرحمن الرحيم. الأستاذ المساعد دكتور أحمد صلاح حميد من كلية طب الاسنان قسم جراحة الفم والوجه والفكي. محاضرة هذا اليوم سوف تكون على dental management of patient with liver disease, hepatitis, particularly viral hepatitis. First of all, let us give a brief idea about the anatomy of the liver. The liver is situated in the upper right quadrant of the abdominal cavity, on top of the stomach, intestine, and the right kidney. The liver, like any other vital organs of the body, has many functions, such as metabolism. So it is important in the metabolism of carbohydrate, proteins, and lipids, and also amino acids. Also, it has a function in synthetic or synthesis of certain substances, such as the clotting factors or coagulation factors, which is very important in the process of hemostatic mechanism. And also, it has secretory, in which the liver secretes the bile, which is very important for absorption and digestion of fat. At the same time, actually, the liver also has another function, not just secretory, but also excretion of the bilirubin, which is the waste product of hemoglobin. Detoxification, that means removal of certain toxic substances from the blood, and also storage. Here, storage of the liver acts as a store for certain substances such as glycogen, vitamin B12, iron, and so on. Here, I have to mention that the liver also has another function, which is conversion of glucose into glycogen, and vice versa. That means the conversion of glucose to glycogen and glycogen into glucose. So this is the main functions actually of the liver, in addition to other function, removal of the or destruction of the RBC and so on. So here we have to discuss now hepatitis. Hepatitis, by definition, it is the inflammation of the hepatocyte, the liver cells, or the cells of the liver. Hepatitis, actually, it is very important and it is risky because the sequences of hepatitis may lead to liver cirrhosis and subsequently may lead to hepatocyte carcinoma, or what we call liver carcinoma. The hepatitis can be classified either into infectious hepatitis. So this is, or this type of hepatitis occurs due to infection, viral infection, bacterial infection, or parasitic infection. And also could be non-infectious, or what we call toxic hepatitis, which is due to certain chemicals or certain substances, such as highly intake of alcoholic, which may lead to liver cirrhosis also, and also there is certain medication may lead to hepatitis in addition to chemical hepatitis, which is due to chemical substances. Actually, viral hepatitis, which is very important for dentists because this is one of the infectious disease, one of the transmissible disease, that means it can be transmitted from the patient to the dentist or through the dental instrument, contaminated dental instrument to the patient. So this is very important. This can be further classified into viral hepatitis type A, type B, type C, type D, and type E. Actually here I have to give brief idea or brief discussion about these types of the viral hepatitis. Actually all of these viruses, I mean hepatitis type A or B or C, these are occurring due to viral infection, which is type A, type B, type C. All these viruses are actually different genetically. From genetic point of view, these viruses are different. But when you look at the clinical manifestations of these infection, I mean all of the infection, whether A or B or C, all of them give the same clinical manifestation. So there is fever, there is fatigue, anorexia, vomiting, loss, etc. All of these clinical manifestations. But also they are different in the route of transmission. For example, hepatitis type A can be transmitted by oral-fecal route through the contamination of stool. And also type B, which is called also serum hepatitis, can be transmitted through the blood and blood product. This is the same thing, can be applied for hepatitis type C and also type D. Here also, the type A can be transmitted by the oral fecal route, and also type E also can be transmitted through the oral fecal route. So type A and type E can be transmitted through the oral fecal route, and the other B, C, D, can be transmitted by the blood and the blood products. Actually, there's another type which is called hepatitis type G, but this is usually, it is very rare. It is very rarely occur, and also usually through the blood transfusion may occur as well. There's another thing, actually, the incubation period for these viruses also different. For example, in case of type A, which is usually occurs in children, actually in the primary schools, usually takes around 3 weeks, while for the type B, C, D, the course of the disease, it is longer. That means it takes more than 3 weeks, for example, 50 days or 100 days. So the clinical course of the viral hepatitis can be classified into 3 phases. This is applied for the acute viral hepatitis. So there is pre-ekytic phase, and there is a chytic phase, and there is convalescence, or what we call the recovery phase. In case of the pre-ekytic phase, there is non-specific manifestation, or what we call flu-like syndrome, or flu-like manifestation, such as fever. The patient may complain of fever, fatigue, anorexia, nausea, vomiting, vague, dull, right upper quadrant pain, where is the liver situated, and this may last for 3 weeks. At the end of this phase, there is also dark urine occurs near the end of this phase. In the chytic phase, there is what we call jaundice. This is jaundice. This is due to, as I mentioned before, that the function of the liver is to excrete bilirubin, which is the waste product of the hemoglobin. So in this case, due to abnormalities in the liver function due to hepatitis, so there is accumulation of bilirubin in certain anatomical areas. For example, in case of the sclera of the eyes, in case of the mucous membrane of the oral cavity, so there is yellow casting of the eye. We will see this in another slide. So there is, in the chytic phase, there is jaundice and dark urine. And this is the most distinctive symptoms. Light colored stool, pruritus, itching, also bradycardia, and also there is hepatomegaly and splenomegaly. In the recovery phase or convalescence phase, the jaundice will disappear, and also the function of the test, the liver function test, which is the enzymes produced by the liver, also normal. So sometimes the persons, for example, infected persons, usually asymptomatic, but especially in case of young children, but sometimes the symptom may appear abruptly or suddenly. So sometimes the patient is infected, but he is asymptomatic. But in certain situations, the sign and symptom or the clinical manifestation mentioned previously may appear suddenly. For example, such as fever, fatigue, loss of appetite, nausea, all of these may appear abruptly, and this is, we have to take in our consideration during management of such a patient. This is, as I mentioned before, this is yellow casting of the sclera due to bilirubin accumulation in this area, and also could be accumulation of bilirubin in the mucous membrane of the oral cavity, particularly in the floor of the mouth. So the liver function can be tested through measurement of certain enzymes such as aspartate transaminases, or alanine transaminases, or alkaline phosphatase, or gamma glutamine transpeptase. This is These are the enzymes secreted by, these are the enzymes can be secreted by the liver, and through measurement of these enzymes we can know the function of the liver. Actually also there is prothrombin time, which is very important to measure the extrinsic pathway of the hemostatic mechanism, and it's one of the indications whether the patient may have bleeding or not. Dental management. From dental management point of view, the patient can be classified into patient with active hepatitis, that means patient present to dental clinic with active hepatitis, that means with all clinical signs and symptoms, or with all clinical manifestations of the disease: fever, loss of appetite or anorexia, vomiting, nausea, fatigue, all of these. Or could be patient with past history of hepatitis, so the patient infected previously. Or patient with persistent infection, that means the patient might be carrier. And this is very risky because of the transmission of the disease from the patient to the dentist. High risk group, those who are drug abusers, or patients on hemodialysis because of the kidney failures or renal failure, or could be the healthcare workers actually, because those people usually more subjected or more dealing with the patient, particularly those who are affected with hepatitis. Now, how we can manage from dental point of view or dental management of patient with acute hepatitis? First of all, we have to consult patient physician. This is very important actually, in order to determine the type of the viral hepatitis, whether type A or type B. Actually, type A, it is somehow less risky than that of type B. Type B can be transmitted through the blood and blood products, but actually also could be found in the saliva, in the body fluid as well. So we have to know to consult the patient physician in order to determine the cause of the type of viral hepatitis, and also to know the length of the course, because through the length of the course might be beneficial to determine the type of the viral hepatitis. Perform urgent treatment only, just the urgent treatment, and in the hospital, for example, if the patient complains of pain, so in this case we have to deal with pain just. There is no surgical maneuver or surgical treatment. The treatment should be in the hospital with perfect isolation and sterilization. Also, we have to use rubber dam to isolate the affected tooth, double gloves and mask, this is very important. Use low-speed handpiece and minimize using air syringe. Actually, this is in order to reduce aerosol, because as I mentioned before, the virus might be present in the saliva or in the blood as well. We have to avoid drugs metabolized by the liver, for example, local anesthesia. Usually we use amide type local anesthesia. Amide type usually metabolized in the liver. So in this case, with patient with acute hepatitis, we have to avoid amide type, and it is better to use ester type because it is metabolized locally. Also, we have to avoid, for example, acetaminophen, aspirin, tetracycline, ampicillin, and also benzodiazepam, actually, because these drugs can be metabolized in the liver, so we have to avoid, because there is, as I mentioned, disturbances in the liver function, so we have to avoid such drugs. Screening tests such as bleeding time and prothrombin time, because as I mentioned before, the patient with viral hepatitis or acute hepatitis, there is a decrease in the production or synthesis of the certain clotting factors such as type 2 or type 5 or type 7. These factors or coagulation factors synthesized in the liver, so due to abnormal function of the liver, these factors might be deficient. So in this case, the patient might complain of bleeding or profuse bleeding, so we have to check the prothrombin time. As I mentioned, it is very important to give some idea about the liver function. As I mentioned before, to check the bleeding time and prothrombin time, this is in order to assess the hemostatic mechanism. Above all these things, actually, for the dentist, particularly for the dentist, vaccination, it is very important because this will protect the dentist, and it is very important that the dentist to take these vaccinations. So this is the end of the lecture, and thank you for your attention.